And today's panel is comprised of North Las Vegas Councilman Scott Black, who is also the chair of the Southern Nevada District Board of Health, Clark County Commissioner Marilyn Kirkpatrick, who is the vice chair of the Board of Health, Dr. Fermine Leguen, acting chief health officer here at the Health District, Joanne Rupiper, director of clinical services here at the Health District, and Chief John Steinbeck is also here to answer your questions. Dr. Leguen, please proceed. Thank you.
Okay, thank you. Okay, good afternoon, everyone, and thank you for participating on this call with us. We want to give you an update on the vaccination campaign and where we are. As today, we have administered about 60,000 doses of COVID vaccines in Clark County. Those vaccines have been administered not only by the health district, but also by our partners, such as the county, UNLV, Touro University, Roseman, also the cities of Henderson and North Las Vegas, and other community partners across the county. The groups in Clark County that are eligible for the vaccine today are the healthcare workforce, who are, the first group that was eligible for the vaccine. Also, our seniors, senior 70 years old and over, as well as our public safety and security workforce, including also our frontline community support workforce. And those groups are defined in the state playbook for the campaign. We also want to share with you that even so we are offering vaccine every day, we receive limited supplies of vaccines weekly, and based on that, we plan our delivery of services. And at some point, it becomes so challenging to satisfy our community demands and the availability of vaccines at our sites. This is something that is ongoing, and our expectation is that in the near future, it should improve or must improve. I also want to remind our community that we are still fighting this pandemic. It's very painful to recognize that as today we have more than 200 residents of Clark County that have been diagnosed with this disease, and we are almost 3,000 people who have lost their life in Clark County because of the coronavirus. So this is an ongoing situation that we are fighting, and now we need the support of our community, and also for all of us to take advantage of the vaccine as soon as we are eligible and the vaccines are available for everybody. Please go and take your shot, because it will protect you, and also will protect those around you, because the transmission of the virus will decrease as we have more and more people vaccinated against this disease. I would like to introduce Councilman Scott Black. He is the chairman of our board. And Scott, please.
Thank you, Dr. Leguen. I mentioned last week at the media event my appreciation and gratitude for the individuals working diligently to help not only with mitigating the spread of the pandemic over the last many months, but also importantly now, the really challenging logistical effort we have before us to administer the vaccine to those within Clark County that would like to receive it. And so again, I just wanted to say thank you. Every day, these individuals, I don't think they take a day off. Every day they're meeting, discussing, and formulating plans and coordination to really handle this tremendously unprecedented logistical effort. Having said that, as we begin to offer the vaccine to people, more people throughout the community and more groups, I'm asking on behalf of these amazing people who are working diligently for your patience and for your support, for your understanding. Our overarching goal as public health professionals and as a health district is to make sure that everyone who wants a vaccine will get one. And our goal is to do that as quickly and as safely as possible, bearing in mind that everything that we do is contingent upon the supplies that we have on hand to plug into the infrastructure that we've built. So as appointments are available and expanded to additional groups of people in these groups, it's important for you to know that you may not get the first available appointments because we're still trying to get those that are in the most vulnerable categories through to an appointment and vaccinated. But again, appointments will be coming more readily available, and anyone and everyone who wants the vaccine will be receiving it. So again, thank you so much for the team who's helping make this happen. And for those of you in the community, again, I ask for your patience and your support as we work together on this unprecedented venture. Thank you, Dr. Legan.
Thank you, Councilman Scott. I would like to introduce Commissioner Marilyn Kirkpatrick. She is Vice Chair of our Board of Health. Please, Marilyn.
Thank you, Dr. Legan, and I just want to say ditto to Councilman Black's appointment, and I hope that the public understands that many people are doing this for the first time, and we're all working together to ensure that our community is safe. You can continue to help keep us safe by practicing the social distancing, washing the hands, and the face mask. While we continue to roll out the vaccine, understand that there's no process that is perfect. We are flexible and we are working hard to refine our process every single day. So thank you, Dr. Legan and Joanne, for you and your teams and all of the work that you're doing, the National Guard and Chief Steinbach. I know that many of us are not sleeping to ensure that we're efficient and we're getting the vaccine out, and we're still testing for that matter at the same time. So thank you.
Thank you, Commissioner. I would like to introduce Joanne Rupiper. Joanne is our Chief Administrative Nurse and Director of Clinical Services, and she has been leading our campaign efforts. Joanne, please.
Good afternoon, everyone. And I just wanted to say that our teams are working very diligently on getting this vaccine out, and along with Clark County. And I really want to ask for your patience. We're working through the tiers. However, our appointment system certainly isn't perfect yet, and we're working on it. We're in a much better place than we were last week. We have a better system starting tomorrow. And so we are hoping that the public, though, however, does consider to not make appointments when you are not in a certain group. So think about how we can get to our over 70 group and those with special needs, and even our healthcare workers. We're still working on those groups. So I think that's it for me.
Okay, thank you, Joanne. I will ask Chief Steinbeck. He's one of our biggest partners, and with his leadership, he's really helping us a lot. So, Chief, please.
Thank you, Dr. Legan. It's just an honor to be able to work through this process. Of course, we have unknown supplies that are coming to us, and it's very difficult to plan moving forward on how to get those out. I think you're doing a very good job of balancing that, and CCFD and all of Clark County departments and any other cities and every other industry is here to support. So I'm here to answer any questions, but I just want to make it clear to everybody out there that the supplies coming in are very volatile, and once we get more stability to that, you'll see a much smoother process. Thank you.
Thank you. Okay, Corey, would you like to go into the questions?
Yes, sir. At this time, we will open the floor for any members of the media to ask their questions. Please be sure to use the raise hand feature. Up first, we have Jacqueline Schultz from Fox 5. Please go ahead.
Good afternoon. Following up on what Ms. Root Pepper said regarding the website improving starting tomorrow. Wanted to know what in particular that meant. Also have a question regarding the sites in terms of issues. We've heard line jumpers, people showing up without appointments. There was someone who told me that their senior mother was turned away yesterday and Cashman Center ran out of supplies. If you can address those issues as well.
Okay. Joanne, you want to take the first part?
Sure, I'll take the first part. Sure. What I meant by improving our system, we're moving to a different format tomorrow. And we've been testing it at our Western site, and it seems to be working well, where people will register with their demographic information, and that will speed up the process during the clinic. And we're also able to gather more information and send out reminders and those types of things. Okay.
And the second part of the question, I think, was about Cashman, and I don't know, Chief, if you have any details into that piece.
Well, I certainly can't speak to the specifics of what was just reported. I can tell you that we have the Nevada National Guard down there, along with some CCFD fire personnel and other community partners running that site. We want to honor appointments, of course, and we are honoring appointments. Like I said, the supply chain has been a little bit volatile, and we're working out our process at that Cashman site, just like the other sites throughout the weeks or throughout this last week. It's improving. We've been pushing to get more capacity out of that site. So it opened up at 1,000, then they pushed to 2,000. And our goal is to sometime get to 4,000 a day out of that site. We hope, I've gotten a lot of positive feedback as to how the site is running. Our desire is that that is what most of the people that are down there experience. There are, so the way the vaccine, and I'm a fire chief, and Joanne works with vaccines, so she can explain this much better than I can. But the way that the vaccines work is that there's times associated with the vaccines, specifically after you've opened up a vial. Sometimes there's an opportunity there and a desire on our part to make sure that none of that is wasted. If that ends up going to somebody that doesn't have a scheduled appointment, then that's better than the vial being wasted. But as has gotten, certainly has improved. We think that the people coming through there without appointments and without the proper proof that they were in the right category or right tier, excuse me, will be extremely minimal, if not totally non-existent. So that's the way that we're operating there. And we apologize to anybody that was inconvenienced by that and hope to get them in as soon as possible.
Okay. Thank you, Chief.
Our next question today comes from Mary Hines.
Thank you. I've spoken to hundreds of seniors, heard from hundreds of seniors, 70 and up, who haven't been able to make appointments. I'm wondering, what is the rationale for opening up vaccines to so many additional groups as you did Friday, when you still have served many members of our older population who are those at greatest risk? What is the explanation for that?
Okay. Well, the way that we look at this was based on original planning. The seniors that we start offering the vaccine at our sites is part of a combination between our mass vaccination sites and the vaccination opportunities that will be or actually are already available starting today at local pharmacies. I don't know if you if you saw the announcement from the state that came up yesterday that Walgreens and Smith pharmacies will be offering a vaccine to the seniors starting today, and also they provided a link for appointment for seniors at those facilities. So what it means is that starting from today, the seniors will have the opportunity to receive the vaccine at local pharmacies close to the neighborhood, in addition to what we are offering at the mass vaccination sites. Uh, so that's the rationale for us when we decided to open for the seniors, waiting for the complement from the local pharmacy that started today, and also because we still have to support the vaccination uh, the workforce, and that's what we're trying to accomplish.
Our next question today is from Mr. John Trainer.
Hi, thanks, guys. Just a two-part question. At this very moment, how many days worth of vaccine do you think you have currently? And the second question for you, we've had reports of some municipalities, some cities vaccinating their employees. Can you verify if that is happening, and if so, why that's allowed?
Okay, Joanne, you want to take the first piece?
The first part, so the vaccine, it depends on the demand, of course. So, and the allotments from the state. So we put our order in on Tuesdays, and we'll find out tomorrow what we will get next week. So we expect our vaccine supply to be adequate through Monday, Tuesday. We can only get 1 week of a vaccine at a time.
Right. The second part of that, we are distributing vaccines to multiple partners in the community, including local jurisdictions or cities, and those partners are asked to administer vaccine to those groups that fall within the lanes that we are currently working, which is the seniors, healthcare workers, safety, and how we call the other group, the frontline community support. So on those guidelines, all those sites are asked to operate, and that's what they have been doing, including offering vaccine to the seniors at the site.
Next up is Mr. Jeremy Chen.
Hi there. My question is pretty much regarding, since we now have the new Biden administration in place, the president now saying that his goal is to vaccinate or at least administer 100 million doses of the vaccine within the first 100 days. Are there any sort of needs or hopes with the likelihood of more federal involvement in terms of how the health district can roll out the vaccine to everyone that needs it at this point? Obviously, all across the country, there have been kind of news of kind of a little bit of a disconnect as far as how many vaccines were available and whatnot. So I wanted to see if how that would affect, the needs of the health district. And the second question is more of a clarification. Did you mention there's 60,000 so far that have been doses administered in Clark County, or is that how many the health district has at this point? Thank you.
Okay. Yeah, I said in the beginning that there have been 60,000 doses administered in Clark County. Today, I would say earlier this morning, the number of doses available at the health district was, I believe, about 26,000 doses that might actually be gone through the weekend. Regarding the new administration, well, I mean, we are just within minutes of the new administration. It just, President Biden just took office at noon Eastern time, and they have mentioned plans to enhance the vaccination campaign and provide additional resources. This is something that, again, is very early on that process. We don't have any specifics right now locally that we could provide to you because, again, it's just the very first day of the administration. I don't know if Commissioner Kirkpatrick, you want to add something to that?
Yeah, thank you, Dr. Legon. We are working very close with our congressional delegation, and we have asked for 100,000 just for Clark County a week through July. So as they're working to do that 100 million, we want to make sure we're also working with the state very closely and our congressional delegation to ensure that Nevada is one of the ones with the squeaky wheel trying to get more vaccines as soon as possible, because it's been great to see that, you know, over 70% of the people are very interested in getting the vaccine, and we want to have as much of the vaccine as possible in our community. So while Biden is only been there just a few minutes, I think on our time, we've already been working with the administration and our congressional delegation to ensure that we get that we have our list in already on what we'd like to see and what we think our community needs.
Our next question today is from Michael Scott Davidson.
Hello. I had a quick question about vaccine distribution. So the state's plan and has called for, on multiple occasions, equity in distribution of COVID-19 vaccines among different populations. I'm wondering at this point what efforts the SNHD or other local governments that are distributing the vaccine here in Clark County are undertaking to measure and ensure and kind of just keep tabs on whether our vaccine distribution is equitable, not only in its distribution to the elderly or these groups that we've prioritized, but also racial groups, across different areas of town, as we know that some zip codes have been particularly hard hit in Las Vegas, the Las Vegas Valley alone. What's being done to measure that equitable distribution and kind of measure where we're at as far as that goes?
Okay, I will start and anybody can follow. The first thing I want to say is that the number of vaccines available in Clark County is very limited, have been very limited, and that has, I would say, dictated how we approach the campaign until today. We have been working with the local jurisdictions in order to facilitate distribution of the vaccine across the county, not just at one or two major sites. And that's why we opened a Cashman recently, and we opened a vaccination site at the high school here, and also we opened a vaccination site at our main facility at 280 Decatur for the Southern Nevada Health District. And then the city of North Las Vegas opened a vaccination site, and the same for Henderson. And the university, UNLV, opened a vaccination site also, and in addition to other partners that have been offering vaccine. So that is kind of an initial approach to us. Our intention as the supply of vaccines increase, then we will be able to send out mobile teams or strike teams that will actually be deployed to specific areas of the community, and we have been working with our commissioners, and also we recently have a meeting with a representative of the of the different churches across the county to ask for the feedback and support once we are ready to go deeper into the community, because we want to be able to offer that vaccine, but also more than offering the vaccine, to receive a positive response from all segments of our community. And we are asking those who are closer to the community to be active participants in the message that we are trying to deliver. So in other words, our strategy is to, in addition to the large mass vaccination sites, deploy things that will be targeting specific areas of the community, including the zip code that you mentioned before, which we already identified, and those are zip codes heavily populated by the Hispanic community. But also we have concerns about the African American community as well, in terms of access to the vaccine and willingness to receive the vaccine. So there are multiple elements to this issue of concerns about equity, and we are working towards reaching that goal.
Our next question comes from Megan Messerly.
Hi there. Thanks for doing these every week. I wanted to ask, I heard from a rideshare worker who had made an appointment at Western High School and was turned away, and they were told that no rideshare employees could get vaccinated. And I know you all have said you are vaccinating essential public transportation workers as part of that frontline community support group. And under the state's playbook, they do include taxi and rideshare employees as part of that essential public transportation group. I was just wondering if that was done in error, or if you all have different guidelines, as far as the finer points of who fit into some of these categories, as far as, who should be making these vaccine appointments right now.
Honestly, I mean, you're talking about a very specific situation. I don't have that information. What I can tell you is that our team at those places, they try to honor as much as possible first the appointments, people who had appointments, and fall into those categories, and also, of course, the issue of the age group for people who do not fall on any of those categories. I exactly that particular case, I don't have an answer for you because I don't have that information. So.
As a quick follow-up, I mean, is Southern Nevada Health District, is the plan to adhere to the state's playbook, including those, finer point categories that they detail in there beyond the sort of broad brush, essential public transportation worker descriptions?
So Megan, this is Marilyn, and here's what I'm.
Mary, yeah.
Okay. Sorry. And Megan, here's what I want to tell you. One, understand that we're all doing our very best to be consistent and to move through the process. But remember that we have a lot of volunteers that are helping. We have a lot of folks that are out there. There's a high demand. So we're trying to manage to make sure that people are not standing too long. We're trying to manage that people are coming through the line as quickly as possible. So are there going to be those one-offs? Absolutely. And I think that you guys recognize that things happen, right? So there are, but what we're hearing from predominantly the 17-year-old group, that the experience has been good and that they feel comfortable and that they know that we are working hard. I stood at Cashman for about 4 hours myself on Sunday, and that is all of what I heard. Is there one or two that maybe we missed it, or, and that happens in anything. I mean, understand 2,000 people vaccines in an 8-hour period, that's yeoman's work, right? Is there going to be those one-offs? Yes. Do I wish Facebook would go away for a week because there's so much miscommunication out there? But we are working tirelessly. And as you look at that frontline list, and the frontline community, it is a broad group of folks, right? It is our social service workers, it's our people who are running our WIC offices, it's our people that are out there, boots on the ground every single day. And so we are working to address as many of those as we can with the limited amount of vaccine that we have. So we're focused on the bigger, broader picture on how many of those folks that we can and cannot get. I have talked to hundreds of constituents that may have got misdirected or may have filled out 5 appointments when they only meant to do 1. And we are trying to balance all of that. And every constituent that I've talked to, we've been able to resolve their issue, and we'll continue to work through those one-offs that happen. But we really do, for the public's good, we need to focus on the positives of what we're doing. We are not Florida, where senior citizens are waiting 8 hours in line to get a shot. Sure, maybe they're waiting an hour, but the process is very good for them. They're feeling good about it. We are not other states that haven't started yet. So I really hope that all of you can focus on some of the positives, because the last thing that we want to do is make people believe that the process is so awful that they don't want to come and get their vaccine, because that does not protect our community for the long term. And we are going to have to make some adjustments. We're not perfect. And anything that we do, we have to make adjustments. So we are working through as many of those frontline people that are out there facing the community every single day. And we continue to evaluate that list every single day based on what's going on. As Chief Steinbeck told you, the amount of vaccines that we have. And so it's not our intent to turn anybody away, but at some point we want people to have appointments and we want them to come prepared. And there's a couple of things that I think we're not talking about here today that we need to. We need to encourage our seniors that if you use a walker, you normally are in a wheelchair and you can't stand for a long period of time, or you have a mobility scooter, please bring those so that you can be more comfortable while we're waiting through the process. We also need to remind people that please book 1 appointment, not 5 across the valley. I had a list yesterday where one person booked up all 10 appointments for 1 spot. And that's not helpful either. So we need to do a better job on public messaging, letting people know that, yeah, we can run tight on vaccines. And at some point we may run out, which is a good thing, because then we can ask for a lot more. Do we want people to be comfortable and be prepared when they come to see us? Absolutely. And 3, are we doing everything as a community to get as much of this into our neighborhoods to ensure that people have a better chance of being protected? Sorry, Megan, I'm just as passionate about everything that we're trying to do here.
We do appreciate everyone's participation today. As mentioned earlier, we are doing just 1 question per media outlet. And if you have any follow-ups, please reach out to the Office of Communication. If you're a member of the public and have any questions, send those to SNHD Public Information at snhd.org. In a moment, we will take a question from Telemundo for Dr. Legend, but in the meantime, do we have any final comments from anyone on our panel? All right, seeing none, I guess we will move on to our Telemundo question. Cynthia, I'm unmuting you now. Oh, wait. Okay. One moment. Hold on. Let me unmute you. Okay, there you go.
Okay, thank you. So I did want to point out one thing. Clark County is going to be sending out a news release today with Southern Nevada Health District. You are going to read that Cashman we don't have any appointments for Cashman for this weekend. So we will be closing Cashman over the weekend. We will be refining our process. We will be getting our new system up and running and plenty of training. So I don't want you to be caught off guard, and I don't want you to tell people it's never coming back, because it is coming back. But we are, we purposely didn't schedule appointments because we want to make sure that we can get through our new system and be ready to go and even more efficient early next week. So I just wanted, sorry, Dr. Lagon, I just wanted to put that out there so they weren't surprised.
Anybody else on the panel have anything to say?
I'll just say one thing about our appointments, that please come at your appointed time. We are having people come early or late, and it really is important that you come on time. And we allow a certain number of appointments per time frame. So if you come early, that really clogs up the system. And also, as far as our staff are really working hard to get these processes down. And like many have said, some are volunteers, and they're learning as we go along, especially this first couple of weeks. So please be patient with them and be nice to them. They're trying their best. Thank you.
Thank you, everyone. Now we're going to take our question from Cynthia from Telemundo.
Hola, doctor Leguen. Si nomás nos puede hablar sobre las dosis que las personas han recibido y sobre cómo están pidiendo. La meta es pedir más vacunas para el sur de Nevada.
Okay, gracias, sí. Bueno, decíamos que hasta el día de ayer se han administrado alrededor de 60,000 dosis de vacuna contra el coronavirus aquí en el condado Clark. Estas vacunas han sido administradas no solamente por personal del Distrito de Salud, sino también por otras organizaciones que participan en esta campaña, tales como el condado de Clark, las ciudades de Henderson y North Las Vegas, así como también la Universidad de Nevada, UNLV, y las universidades de Toro y Roseman, y también los hospitales y otros proveedores médicos aquí en la comunidad. O sea, ha sido un esfuerzo de gran número de personas, no solamente de Distrito de Salud, y hasta ahora hemos podido vacunar alrededor de 60,000 personas. En estos momentos, el Distrito de Salud tiene un número aproximado de 25,000 dosis de vacuna disponibles que esperamos sean administradas en el transcurso de los próximos días, y esperando el próximo envío de vacunas del gobierno federal, que debe arribar la próxima semana para poder seguir esta campaña. También queríamos decir que el centro de vacunación que tenemos abierto en el centro Cashman, que ha estado operando por varios días, no estará abierto durante el fin de semana, o sea, el sábado, viernes, sábado, domingo, porque estamos ahora en una transición con el sistema electrónico de las citas de este sitio, y por tanto no va a estar disponible durante estos 3 días de fin de semana, y la próxima semana ya comienza nuevamente a ofrecer sus servicios. También queremos recalcar que estamos en el medio de esta epidemia. Desgraciadamente, nuestra comunidad ha sufrido los embates de la pandemia. Nosotros aquí en el condado Clark hemos tenido ya más de 200,000 personas diagnosticadas por el coronavirus, lo cual representa un desafío tremendo para la vida social y económica de esta comunidad. Igualmente hemos perdido casi 3.000 vidas por el coronavirus, lo cual afecta muchas familias de esta comunidad, tanto aquellos que perdieron a sus seres queridos y cercanos, como otros que han perdido amigos y compañeros de trabajo. Y es algo que tiene un impacto negativo en nuestra vida diaria. Por tanto, queremos que la comunidad reciba la oportunidad de ser vacunada. El número de vacunas disponibles en estos momentos todavía no está al nivel suficiente como para satisfacer las necesidades de todos en la comunidad, pero sabemos que el número de vacunas que recibamos en las próximas semanas va a ser cada vez mayor, y por tanto van a ser mayores las oportunidades que vamos a tener todos de ser vacunados. Y lo que sí les pedimos que una vez que llegue esa oportunidad, por favor, tomen esa oportunidad, vacúnense, porque así se protege usted y también está protegiendo a sus seres queridos y a todos en esta comunidad. ¿Por qué? Porque está disminuyendo la posibilidad de que el virus se siga transmitiendo en el condado. Eso es muy importante para todos.
And next up, we have Fernando. Go ahead, sir.
Thank you very much. Doctor Leguen,
Hola, Fernando.
¿qué tal estás?
Bien, bien, ¿y tú?
Bien, mira, verás, en relación ante lo que ha comentado antes la comisionada Kirkpatrick, bueno, nosotros voy a hacerte preguntas, pero no queremos, como decía ella, dar la sensación de que está siendo un desastre el sistema de vacunación para que la gente luego se desanime y no vaya. Nosotros no tenemos esa intención, pero sí que queremos saber más o menos cómo está yendo el sistema de vacunación. Entonces, por eso te quiero preguntar, ¿cuántas vacunas ustedes la semana pasada decían esperaban vacunar en el sur de Nevada entre 40.000 y 45.000 personas a la semana? Esta ha pasado la primera. ¿Cuántas se han vacunado? ¿Qué problemas ha habido? ¿Y cómo creen que se van a solucionar? ¿Y cómo creen que van a estar funcionando el sistema de vacunación las próximas semanas?
Claro, gracias, Fernando. Bueno, nuestro objetivo de llegar a las 40 y tantos mil personas vacunadas es algo que nosotros esperamos alcanzar la próxima semana. Esta semana esperamos vacunar más de 25.000 personas en nuestro estimado, que sería la cantidad suficiente como para prácticamente terminar las vacunas que tenemos en estos momentos en almacenamiento en el distrito de salud. Y a partir de ahí, si recibimos las vacunas suficientes a través del Estado y el gobierno federal, pues vacunar al menos 46.000 personas semanales. Y de acuerdo, como dijo la comisionada anteriormente, con informaciones y pedidos que hemos hecho al gobierno federal, si estos se cumplen con la nueva administración, que tiene planes bien ambiciosos de expandir la vacunación, pues pudiéramos alcanzar cifras aún mayores con la asistencia directa del gobierno federal aquí en el condado Clark, ayudándonos con más vacunas y con también recursos para que podamos abrir mayor número de centros masivos de vacunación. No sé si eso responde a tu pregunta.
Sí responde a la pregunta. Entonces, a la vista de que sí que vamos a poder conseguir rápido el objetivo de vacunar a tantas personas, ¿verdad?, a la semana, que 45.000, pues que supone casi 200.000 al mes, ¿no? Un número grande. Vamos a ver que vamos a avanzar en fases, ¿verdad?, en fases de prioridad y de edad. Las personas que estén atentas, ¿no?, que igual nos puedan ver en nuestro canal de televisión qué es lo que tienen que hacer el mensaje. Creo que la semana pasada hablamos de un lugar para registrarnos en donde se nos avisaría cuándo va a ser nuestro turno. No sé si nos puedes hablar un poquito de ello.
Bueno, nuestra página web tiene ¿cómo se llama? Una línea, un alcance para que las personas se anoten para recibir su vacuna. Y también esa misma página, las personas pueden alcanzar otros sitios donde hay también información acerca de la campaña de vacunación, tales sitios como, por ejemplo, el sitio que se llama Immunize en Nevada, que ofrece muy buena información y también ofrece cómo acceder a los sitios de vacunación o a otros recursos que proporciona el Estado. Y también desde nuestra página web se puede acceder al sitio también de la página del Departamento de Salud del Estado, donde también hay recursos adicionales. Pero en general, la mayor parte de la información y recursos que las personas necesitan en el condado Clark, la pueden encontrar en nuestra página web.
Okay, thank you, Doctor. That wraps it up for today. If anybody has any,
Thank you.
anybody in the media has questions, once again, reach out to the Office of Communications. Otherwise, we will see you all next time. Thank you and have a great afternoon.
Thank you, Corey.